Kristin Rahman, and I'm a registered nurse. What I love most about nursing is the regular opportunity to take care of people from different backgrounds. I have the chance to take care of people who make no money, who are homeless, living on the street, to taking care of people who are very affluent. I've taken care of people of different ages, from very young, like 18 years old, all the way to people who are almost pushing 100 years old, and just people from all backgrounds, every race that you can think of. It's just really great to be able to interact with a diverse group of patients. So the education that you need to become an RN is beginning with the Associate's degree of Nursing, and that is going to help you get an entry-level job, mostly in a skilled nursing facility or a long-term care facility. After that, you can pursue your Bachelor's of Science in Nursing, and that's going to open up a lot more opportunities to be able to get a job in a hospital, in community clinics, in public health, or even being like a school nurse. And then beyond that, you can pursue your master's degree of nursing that can help you get a job in nursing education or become a nurse practitioner. And if you're really ambitious down the road, you can get a doctorate in nursing, and that's gonna, open up our opportunities to work in administration and beyond. So after I graduated my nursing program, it was not that hard to get my first job. I believe there's just always going to be a need for nurses. I live here in Phoenix, Arizona, and there's several major hospitals, and they have lots of nursing positions to fill. So as a new grad, I went to my first interview, and I got hired that day. They offered me a job a couple hours after my interview. So it was pretty easy to get a job after I graduated. So to prepare for employment, you have to study for the NCLEX board exam. Depending on your confidence level and how much you feel like you grasp the information, some nurses study for just a couple months before they take the NCLEX. I had some friends that studied for like 6 months, just kind of whenever they felt like they were prepared and confident enough to go take the exam. It is a pretty extensive exam. I believe they ask you like around 100 to 150 questions. And if you can pass that, then you get your license, and then you can go out and apply for jobs. In addition, I also compiled a portfolio that I brought with me to my interview. In the portfolio, I actually placed my transcripts from school, my resume. I also put a copy of my capstone, which was like our final project that we worked on for my bachelor's degree. And then I did do practice interviews with some of my friends. We would get together and look up what are common interview questions that are asked for nurses, and we would ask each other and go through them. Really, it's about just building that confidence, knowing that even though you don't have the experience, that you're willing to learn and just walk in there and say, I can do what it is that you need me to do. So for me, I do work full-time at a hospital, and a typical full-time schedule is 3 12-hour shifts. So in one 7-day week, we just have to work 3 days. So typically you have 4 days off every week. They are long shifts at the hospital, but it is very nice to have those days off. There are nurses that work full-time, and they work in clinics, outpatient, and they do work 5 days a week, and they work 8-hour shifts. But in nursing, it's really nice. It's very flexible. Some nurses who don't need to make a ton of money based on their needs work 2 days a week. But if you're looking to make more money, you can always pick up overtime and work 5-6 days a week, whatever you feel that you can handle. Nurses get paid depending on where they live in the country. If you're in a bigger city, you typically get paid more to compensate for the cost of living. So you will expect to get paid less if you work in a more rural town. Also, it does depend too on if you're working in a hospital setting. Nurses in the hospital tend to make more than those who work in clinics. Also, I looked it up, at least for here in Phoenix, Arizona. The average rate for a new grad nurse is about $28 an hour. But they do tend to compensate you based on your years of experience. So the longer that you work, the more that you'll get paid. So the average pay right now in Phoenix for a more experienced nurse is about $44 an hour. So the hospital setting is very fast-paced. Once you get to work, it's go time. You get report on your patients, you go meet your patients, you sit down and you start studying their chart, you study what their history is, what their labs look like, what testing do they need that day, what medications are going to be due, and you basically have to plan out the day of how you're going to take care of multiple people, calling the doctor if you need for certain things. So it is very fast-paced. If you like to move around and not really be sitting down at a desk the whole time, nursing in the hospital would be a good job for you. But don't be afraid, there is other settings in nursing that if you're not so into the running around and moving around a ton, clinics are a lot more slow-paced. It's not as demanding physically working at a clinic. You only see like 20 patients a day and it's very relaxed. So there are options. In my opinion, the most challenging thing to prepare for is the stress that may come in your future career. Nursing can be stressful when you're dealing with people who are really sick in the hospital. Their family is stressed, they're feeling emotional, the patient can be feeling emotional and stressed, and sometimes it's very easy to get rubbed off on you. But you just have to know how to, care for that person with empathy. But at the same time, when you go home at the end of the day, leaving work at work and coming home to your loved ones or whomever, your pets, and just kind of resetting and having a sense of gratitude that you get to do what you do, caring for others, letting go of what was stressful of that day and kind of doing what you need to do to take care of yourself so that you can go back, your next shift and take care of people again. If you decide to venture into nursing, just know that nursing school is very challenging. Just got to be mentally prepared that it's going to be difficult. You got to have to spend a lot of time studying, preparing for exams. It was definitely one of the most challenging times in my life personally. So when you reach those moments where you feel overwhelmed and you feel like, I don't know if I have what it takes, I don't know if I can keep going, really just stop and breathe and relax and just assess, is this something that I really want to do? If it is, you can find the strength and the motivation to keep going. You can make it through. You just gotta take those moments to just pause and keep going. Find the strength to keep going. You can do it.